Kaohsiung Veterans General Hospital, Department of Orthopedics. This is the Department of Orthopedics of Kaohsiung Veterans General Hospital, which has the only clinical gait analysis laboratory in Taiwan. In this gait laboratory, we perform several clinical tasks, including providing a comprehensive and scientific perioperative evaluation of a person's gait pattern, identifying the associated pathologies, providing better communication between the patients and caregivers, and scientific documentation of gait parameters. We provide thorough information for an orthopedist to make treatment plans for children with cerebral palsy.
Gait analysis refers to the captured signal generated from limb movement in our walking, using high-tech and computer technologies. Then, after integrating and analyzing the captured information, we can know the problem of the patient in his gait. It's mainly used in neuromuscular diseases clinically, especially in preoperative and postoperative assessment on children with cerebral palsy.
We are proud to be the first orthopedic department among all the hospitals in Southeast Asia to have an internationally certified bone tissue preservation bank. Through a strict and meticulous quality control protocol, we ensure that all bone grafting procedures of patients in our hospital are done in an uncontaminated and safe manner.
Hospitals with allograft bone banks are common in Taiwan, yet due to a lack of standardized authentication system for quality control, accidental transmission of infectious diseases such as AIDS and hepatitis has occurred after bone grafting. Therefore, in an effort to minimize the incidence of such unfortunate surgical complications, a quality control certification requirement was implemented several years ago. And we are the first orthopedic department in Southeast Asia to be accredited with such credentials. Thus far, the fact that there's not been one single incident of allograft bone-induced disease transmission is a strong testament to our quality control process. In addition, certain cases of bone tumors or trauma fractures require surgical treatments in stages, and temporary allocation of bone segments are needed. With a well-controlled bone bank, we can assure patients that their bony parts are safely preserved prior to their replantation.
In keeping with the trend of minimally invasive surgery, the Department of Orthopedics has introduced the latest navigation robotic arm for artificial joint replacement surgery. With the aid of such highly advanced surgical innovation in keeping the surgical wound to less than 5 centimeters, our fully trained arthroplasty experts can achieve optimal surgical results with the least postoperative pain for the most debilitated arthritis patients. Our track record of excellent surgical results has helped us earn a great reputation, not only domestically, but abroad as well, as evidenced by the fact that we have performed numerous such procedures for patients from places such as the U.S., Australia, China, and Southeast Asia, etc.
In the field of arthroscopic surgery, we have a specialized team comprised of fully trained surgeons with expertise in all joint regions. In fact, according to the Taiwanese Bureau of National Health Insurance Registry, we accounted for the most shoulder arthroscopic surgeries performed in southern Taiwan. We'll have one like the Da Vinci, an orthopedic robotic arm at our hospital. We can perform total knee replacement within a 5-centimeter incision, so efficiently that we can have the surgery today and discharge the patient tomorrow. The patient will be able to walk that very night. So far, we've had quite a number of patients coming from abroad for operations. Case in point, a patient from Sichuan, China, came for a hip arthroplasty surgery while touring in Taiwan. The entire hospitalization course was so smooth that after being discharged, she was able to resume the rest of her tour and return to China as scheduled.
Another special feature of our department is that we are one of the very few hospitals in Taiwan to be equipped with an intraoperative 3D fluoroscopy and computer navigation system. This advanced surgical installment helps provide the optimal accuracy during insertion implementation of orthopedic devices in fracture and spine surgeries, minimizing complications of misplacement.
As for spine surgeries, one of the most common concerns of the patient is the possibility of paralysis due to surgical mishaps. The 3D fluoroscopy and navigation system is just one of the latest technologies invented to prevent such complications from happening. To further ensure patient safety, we also deploy a specialized intraoperative electroneurological monitor during the operation. to protect spinal nerves from being injured accidentally.
The Department of Orthopedic Surgery strives for excellence in both clinical service and academic research. We perform an average of 340 operations per month and have published numerous SCI research articles in recent years. Furthermore, we successfully obtained 2 clinical-related patents in 2014. These accomplishments are the illustration of our team's strength. In the future, Kaohsiung Veterans General Hospital Orthopedic Department will continue to provide the most comprehensive and complete care to patients from all over the world.